Hello friends. Welcome back to our channel on health tips today. We have an important topic to cover: the early signs and symptoms of liver cirrhosis. This progressive condition, characterized by the buildup of scar tissue within the liver, can have devastating consequences if left undetected and untreated. Cirrhosis is often the end result of long-term, chronic liver damage inflicted by various culprits like excessive alcohol consumption, obesity, viral hepatitis infections, or other liver diseases. As healthy liver cells become replicated by fibrous scar tissue, the organ's ability to function properly becomes increasingly compromised over time. What makes cirrhosis particularly insidious is that it can advance silently for years without causing obvious symptoms in its early stages. Alarmingly, data suggests that over 25% of Americans suffer from non-alcoholic fatty liver disease, a major risk factor and potential precursor to cirrhosis. Being able to recognize the subtle warning signs is therefore crucial for initiating treatment before irreversible liver failure occurs. In this comprehensive video, we will shed light on 10 potential early indicators of liver cirrhosis that you should not ignore. We will also delve into practical lifestyle adjustments, dietary strategies, and natural remedies that may help reverse liver damage and promote healing if you find yourself experiencing any of these red flags. Early intervention is key when it comes to this condition. Fatigue and weakness. One of the earliest and most common symptoms of liver cirrhosis is a persistent, debilitating fatigue that can significantly impair quality of life. As scar tissue replaces healthy liver cells, the organ becomes less effective at eliminating toxins and metabolic byproducts from the bloodstream. This buildup of substances acts like a slow poison, sapping your energy levels even after getting adequate rest. Many patients describe it as a bone-deep exhaustion that makes even simple daily tasks feel overwhelming. If you find yourself abnormally drained despite sleeping well, it could be one of the first indicators that something is amiss with your liver's core detoxification capabilities. Loss of appetite and nausea. Beyond just filtering toxins, your liver is also a metabolic workhorse, producing bile and other enzymes critical for digesting fats, proteins, and carbohydrates. Cirrhosis can severely disrupt these processes. As liver function declines, you may experience early satiety, where you feel uncomfortably full after consuming just a small portion of food. An inability to properly metabolize nutrients can also trigger chronic nausea and an overall lack of appetite. Food begins to seem completely unappetizing as your body struggles to break it down effectively. This gastrointestinal discomfort and lack of hunger are often accompanied by rapid weight loss, another red flag. Swollen legs and ankles. Edema. Take a close look at your lower extremities. Are your ankles and lower legs appearing swollen or puffy, even when you haven't been standing for long periods? The damaged cirrhotic liver loses its ability to synthesize adequate levels of protein molecules like albumin that normally help regulate fluid balance within the body's tissues. This causes excess fluids to accumulate and get trapped in the legs and ankles, resulting in uncomfortable swelling called edema. You may notice the indentation from your socks lingering on your skin after removal. The buildup of fluid can also cause your ankles to appear severely distended. Itchy skin. Pruritus. As liver disease progresses, bile salts and other biochemicals can accumulate underneath the skin due to the organ's impaired clearance abilities. This triggers an intense, all-over itchiness known as pruritus that can become completely maddening. Unlike a typical localized rash or reaction, this itch has no visible source. The skin appears completely normal despite feeling like a million tiny fires are burning underneath it. The relentless need to scratch can disrupt sleep cycles and concentration. Pruritus often starts on the extremities before becoming generalized across large areas of the body as cirrhosis worsens. Spider angiomas. Keep an eye out for peculiar radial clusters of tiny dilated blood vessels appearing on your skin, especially on the face, shoulders, arms, and upper bodies. These spidery patches, called spider angiomas, can arise due to the hormonal imbalances induced by advancing liver disease. As cirrhosis impairs the liver's ability to metabolize estrogen, excess levels of the hormone can cause capillary dilation and result in these unsightly web-like lesions spreading outwards from a central point. While normally harmless, their presence can be an early indicator of worsening liver dysfunction. Dark urine color. One of the main jobs of a healthy liver is to metabolize bilirubin, the yellowish pigment compound produced from the breakdown of old red blood cells. As cirrhosis sets in and liver cells become progressively more scarred, this critical ability becomes compromised. With bilirubin building up in the bloodstream rather than being excreted properly, it can cause your urine to appear dark brownish or cola-colored, a stark contrast from its normal pale yellow hue. This abnormal coloration is often one of the earliest visual cues that your liver may be struggling to perform its vital waste processing role. Bruising easy bruising in a properly functioning liver. Various proteins and clotting factors are produced to enable effective wound healing and prevent excessive bleeding after injuries. Cirrhosis disrupts this process by impairing the organ synthesis of these critical compounds. You may start noticing that even minor bumps or scratches are causing unseemly bruises to appear on your skin that linger for weeks. Easy bruising can become so pronounced that you develop patches of ugly purplish-yellow discoloration all over your extremities from inconsequential incidents you can't even recall. It's a visible sign that your liver's role in clotting and healing is faltering. Confusion and slurred speech. Hepatic encephalopathy. As cirrhosis reaches more advanced stages, the buildup of toxins like ammonia that would normally be neutralized by a healthy liver can start to take its toll on brain function. This condition, known as hepatic encephalopathy, causes a range of neurological symptoms including confusion, poor coordination, mood personality changes, slurred speech, and excessive sleepiness. Ammonia crossing over the blood-brain barrier can disrupt the delicate biochemical balance of the brain, almost resembling a constantly muddled state of intoxication as it impairs cognitive abilities. Hepatic encephalopathy is a serious complication requiring immediate medical attention. Swollen abdomen. Ascites. One of the most visibly striking potential signs of liver cirrhosis is a severely distended, swollen belly caused by ascites. As scarring progressively worsens in the damaged liver, it can start to obstruct normal blood flow, increasing the pressure in the vein that carries blood from the intestines and spleen to the liver. This backed-up pressure, called portal hypertension, forces fluids out of the vascular system into the peritoneal cavity. Over time, liters of liquid can insidiously accumulate, causing the abdomen to protrude outwards and become excruciatingly painful and taut to the touch. Severe cases of tense ascites can make it difficult to breathe comfortably by compressing the lungs and diaphragm. Feminizing features in men. When the liver's ability to properly metabolize hormones like estrogen becomes compromised by cirrhosis, it can cause an imbalance in men that leads to distinctly feminizing physical characteristics. One of the most obvious changes is gynecomastia, a noticeable enlargement or swelling of breast tissue that can produce a woman-like chest. Other effects of elevated estrogen levels can include shrunken testicles, loss of muscle mass and strength, redistribution of body hair growth patterns, and excessive abdominal fat accumulation in a typically feminine shape. These body morphology changes can understandably take a psychological toll for many men grappling with cirrhosis. Understanding fatty liver disease. Fatty liver disease is a condition in which excess fat accumulates in the liver cells, potentially leading to inflammation and liver damage. There are two main types: non-alcoholic fatty liver disease NAFLD and alcoholic fatty liver disease AFLD. Non-alcoholic fatty liver disease NAFLD is a condition that affects individuals who consume little or no alcohol. It is closely linked to obesity, insulin resistance, and metabolic disorders. As fat accumulates in the liver cells, it can trigger inflammation and potentially progress to more severe forms of liver disease, such as non-alcoholic steatohepatitis NASH, and, ultimately, cirrhosis. On the other hand, alcoholic fatty liver disease AFLD is caused by excessive alcohol consumption over an extended period. Alcohol metabolism in the liver can lead to the accumulation of harmful byproducts, oxidative stress, and inflammation, ultimately leading to fat accumulation and potential liver damage. Risk factors for fatty liver disease: obesity and metabolic syndrome. Excess body weight, particularly around the abdomen, and metabolic disorders such as insulin resistance and high blood sugar levels increase the risk of developing fatty liver disease. High-fat, high-calorie diet. A diet rich in saturated fats, refined carbohydrates, and sugary foods can contribute to the accumulation of fat in the liver cells. Excessive alcohol consumption. Prolonged and heavy alcohol intake is a major risk factor for alcoholic fatty liver disease, as well as other forms of liver damage. Insulin resistance and type 2 diabetes. Individuals with insulin resistance or type 2 diabetes are more prone to developing fatty liver disease due to the disruption of normal fat metabolism. Genetic factors. Certain genetic variations can increase an individual's susceptibility to developing fatty liver disease, even in the absence of other risk factors. Preventing and managing fatty liver disease. Maintaining a healthy weight and diet. Adopting a balanced and nutritious diet, rich in fruits, vegetables, lean proteins, and healthy fats, can help prevent and manage fatty liver disease. Achieving and maintaining a healthy body weight through dietary changes and regular exercise is crucial. Regular exercise. Engaging in regular physical activity, such as cardiovascular exercises and strength training, can help reduce liver fat accumulation, improve insulin sensitivity, and promote overall health. Limiting alcohol consumption. For individuals with alcoholic fatty liver disease, abstaining from alcohol or significantly reducing intake is essential to prevent further liver damage. Managing underlying conditions. Individuals with conditions like diabetes, high cholesterol, or metabolic syndrome should work closely with their healthcare providers to manage these underlying factors, which can contribute to fatty liver disease. Medications if prescribed by a healthcare professional. In some cases, medications may be prescribed to manage specific aspects of fatty liver disease, such as insulin resistance or inflammation. However, these should only be taken under the guidance of a qualified healthcare professional. By recognizing the vital signs of liver cirrhosis and understanding the symptoms and risks associated with fatty liver disease, individuals can take proactive steps to protect their liver health. Early detection and appropriate lifestyle changes or medical interventions can help prevent or manage the progression of these conditions. Keep in mind that the complexities of liver cirrhosis and fatty liver disease reveal a spectrum of presentations and intensities, with diverse symptoms among individuals. Consistent check-ins, adherence to treatment blueprints, and transparent dialogues with healthcare guardians shape the cornerstone of effective management and enhanced well-being. This video serves as a compass. Yet individualized guidance from proficient healthcare stewards remains paramount for precise diagnosis, tailored therapeutic avenues, and continuous vigilance over your liver's welfare. So, ensure your subscription, appreciation, and dissemination of knowledge. Until our paths converge again, cherish the journey. Hey there, fellow explorers. Trust that your voyage through this channel has been enriching thus far. Have you cast your anchor by subscribing? If not, let's make that happen. And if you have, explore the wisdom awaiting in the adjacent video. It might just be the beacon you seek.